Imagine you are a young mother in Vienna, 1847. You have just given birth. You are exhausted, you are relieved, and you are in one of the most advanced medical facilities in the world. You should be safe. Within the week, you will be dead. Not from childbirth, not from any illness you arrived with. You will die because a doctor, who genuinely believed he was helping you, did not wash his hands before touching you. And the most disturbing part of this story is not that it happened, it's that one man proved it was happening, proved exactly how to stop it, and the most powerful medical institution in the world told him he was wrong and kept telling him he was wrong for 14 years while the deaths continued. This is the story of Ignaz Semmelweis, the man who discovered how to stop one of the deadliest killers in medical history and was destroyed for it. To understand what Semmelweis found, you need to understand what hospitals were in the 1840s. Today, we think of hospitals as places you go to get better. In the mid-1800s, for many patients, a hospital was where you went to die. Not because doctors were incompetent, not because medicine was primitive in every way, but because of one invisible, unnamed killer that nobody understood yet: infection. The concept of germs did not exist in mainstream medicine in 1847. Louis Pasteur's germ theory was still 15 years away. Joseph Lister's antiseptic surgery was 20 years away. Doctors operated in street clothes. They moved directly from performing autopsies on corpses to delivering babies without washing their hands, not out of laziness, out of genuine ignorance. This was standard practice in the finest hospitals in Europe, and nowhere was the result more catastrophic than in the maternity wards. The disease was called puerperal fever, or childbed fever. It attacked women shortly after childbirth. Fever, abdominal pain, delirium, then death, often within days. In the worst outbreaks, mortality rates in hospital maternity wards reached 35%. 1 in 3 women who gave birth in a hospital did not leave alive. Women in Vienna knew this. They begged to give birth in the streets rather than be admitted. Street births, with no medical assistance, had lower death rates than the hospital ward. Think about that for a moment. The hospital was more dangerous than the gutter, and nobody knew why. Ignaz Semmelweis was born in Budapest in 1818. He trained as a physician in Vienna, eventually specializing in obstetrics, the care of women during pregnancy and childbirth. In 1846, at the age of 28, he was appointed assistant physician at the Vienna General Hospital's first obstetrical clinic. He was idealistic, methodical, deeply empathetic in a profession that didn't encourage empathy. He was troubled, from his very first day, by the death rate he saw around him. But what bothered him most wasn't just that women were dying. It was a pattern nobody else seemed to notice. The hospital had 2 maternity wards. Ward 1, run by doctors and medical students. Ward 2, run by midwives. Ward 1's death rate from childbed fever between 10 and 35%. Ward 2's death rate consistently under 4%. Same hospital, same patients, same disease. Completely different death rates. Why? Semmelweis became consumed by this question. He interviewed patients. He reviewed records going back years. He tested theory after theory. Overcrowding ruled out. Ward 2 was equally crowded. Ventilation ruled out. The wards were structurally similar. Trauma during delivery ruled out. Midwives used the same techniques. He was running out of explanations. Then, in March 1847, something happened that changed everything. A colleague and close friend of Semmelweis, a pathologist named Jakob Kolechka, died. Not from childbed fever, from an infected wound sustained during an autopsy. A student's scalpel had slipped, nicking Kolechka's finger. The resulting infection killed him within days. Semmelweis attended the autopsy of his friend, and as he read the pathology report, he stopped. The tissue damage in Kolechka's body was identical to the tissue damage in women who died of childbed fever. Identical. Kolechka had been infected by cadaverous particles, microscopic organic matter from the corpses he worked with, and Semmelweis's ward, Ward 1, was staffed by doctors and medical students who spent their mornings performing autopsies on cadavers and their afternoons delivering babies without washing their hands. Ward 2, run by midwives, performed no autopsies. They had no contact with cadavers. That was the difference. That was the entire difference. The doctors were carrying death from the morgue directly to the women in their care. Semmelweis immediately implemented a new rule in Ward 1. All doctors and students must wash their hands in a chlorinated lime solution before examining any patient. The results were immediate. Within 1 month, Ward 1's mortality rate dropped from 18% to under 2%. He had done it. With a bowl of chlorinated water and a logical observation, he had cracked one of the deadliest medical mysteries of his era. The medical establishment's response was almost immediate. They rejected him completely. Here is where the story becomes something darker than a medical discovery. Semmelweis published his findings. He presented his mortality data to the medical community in Vienna. The evidence was clear, reproducible, statistically overwhelming, and the response from the most senior physicians in Europe was not curiosity, it was offense, because accepting Semmelweis's theory meant accepting something unbearable, that doctors, educated, respected, well-intentioned doctors, had been killing their own patients for years, possibly decades. The leading obstetrician in Europe, Charles Meigs of Philadelphia, dismissed the idea entirely. He argued that a gentleman's hands could not possibly be a source of disease. A gentleman's hands? Semmelweis's chief at the Vienna clinic, Johann Klein, actively worked against him. When Semmelweis's contract came up for renewal in 1849, it was not renewed. He was removed from the hospital, pushed out of Vienna entirely. He moved to Budapest, continued practicing, continued teaching, continued publishing his evidence. In 1861, 14 years after his discovery, he published his full findings in a book, The Etiology, Concept, and Prophylaxis of Childbed Fever. The medical community's response to the book was largely dismissive or hostile. Semmelweis began writing open letters to the leading obstetricians of Europe. The letters grew increasingly desperate, then angry. Some bordered on unhinged, because he understood exactly what the rejection meant. Every month, the medical establishment delayed. Every year, the hand-washing rule went unadopted. More women died. He knew the number, he kept counting, and nobody listened. In the summer of 1865, Ignaz Semmelweis suffered a mental breakdown. The exact cause is debated by historians. Some suggest early dementia, some suggest severe depression, some suggest, not unreasonably, that watching a preventable catastrophe continue for 18 years, while being called a fool for trying to stop it, simply broke him. His colleagues had him committed to a mental asylum in Vienna. He was 47 years old. He died 14 days after admission. The official cause, an infected wound, caused in the deepest irony history has ever produced, by the very same type of cadaverous infection he had spent his entire career trying to warn the world about. He was buried quietly in Vienna. The ceremony was sparsely attended. 2 years later, Louis Pasteur confirmed germ theory. 3 years later, Joseph Lister introduced antiseptic surgery based on it. The medical world, within a decade, accepted everything Semmelweis had said. His name was eventually added to the textbooks. A hospital in Budapest bears his name today. A university, several medical awards. None of it was any use to the women who died between 1847 and 1865, while the evidence sat on a desk, and men with clean consciences and dirty hands told a grieving doctor he was wrong. Here is the question this story actually asks. Was the medical establishment evil? No. They were, by the standards of their time, educated and professional and sincere. They operated within a worldview, pre-germ theory, where Semmelweis's explanation made no logical sense. Invisible particles on a gentleman's hands killing patients, without any theoretical framework to explain how. It sounded like superstition, not science. And Semmelweis himself, brilliant as he was not blameless in how the story unfolded. He refused to engage with the scientific method his peers respected. He published no controlled experiments. He explained what was happening without being able to explain why. His later letters were genuinely erratic. None of that changes what happened. None of it justifies the deaths. But it reveals something important. The enemy in this story is not malice. The enemy is a system that was structurally designed to protect its own assumptions more than it was designed to protect patients. A system where the cost of being wrong was paid not by the people who were wrong, but by the people in the beds. That system did not end in 1865. The medical profession eventually named a phenomenon after Semmelweis. Not a prize, not a cure, a cognitive bias. The Semmelweis reflex, the tendency of institutions to reject new evidence that contradicts established belief or practice. It happens in medicine, in finance, as we saw with David X. Lee, in government, in technology, in any institution large enough to have more invested in its own continuity than in the truth. Ignaz Semmelweis died alone, infected by the very thing he'd spent his life fighting, in an asylum where nobody believed him. And somewhere in the gap between his discovery in 1847 and the world's acceptance of it 20 years later, in hospital wards across Europe and America, women went in to have their children and did not come home. Not because the knowledge didn't exist, because the people who held power found it more comfortable to disbelieve it. We remember Semmelweis now as a hero. We put his name on buildings. We tell his story in medical schools as a lesson in humility. But humility is easy to preach and very hard to practice when you are the one being told that everything you know is wrong. The question Semmelweis leaves us with is not about hand-washing. It never was. It is about what we do when the evidence contradicts the story we have already decided is true. Because somewhere right now, in medicine, in science, in economics, there is someone sitting alone at a desk with data that will one day change everything, and an institution that is not ready to hear it.